now, the only thing I'm trying to do is just test my equipment real quick to make sure that it's working. That's it. When you do your step wedge test, you can use the rubber band that is on the cord when we give the sensor to you to tie the step wedge to the sensor. Otherwise, it's going to be hard for it to stay on there. So just kind of do a loop-de-loop. The button to turn the X-ray machine on is at the bottom here. There's a power button to turn it on. Some of you got to see it, but there's an icon on your computer screen that says X-ray vision. When you click on X-ray vision, a box will come up asking whether or not you want to run or cancel the app. You will run it. Next is going to ask you if you want to download the many thousands and thousands of images that are stored in that system. You're going to say no. You do not.
It'll take forever for it to load.
You will then click on Capture Images. Capture Images. And it will bring you to a screen where you will have to enter patient information in order to pull up somebody to take x-rays on. So for our purposes, you can put in 222 or 123, and patients that have already been put in the system will come up and you can click on one of them, okay? So I'll do 222. A whole list of people with that in their social will come up. I just click one of them. For your test, you will be taking a full mouth series. A full mouth series includes 18 images. So when you click on that, when you click your patient, you'll go to a page which asks what type of program are you using for your sensor, right? It's going to be Kodak. Click on Kodak. And then it will go to the screen where you have to click on how many images or which teeth you are taking images on. And you're going to click FMX 18. And EPO, you can come get closer so you can see what that screen looks like. And this is what your screen should look like. Okay. It's already placed on number 1. We have the x-ray machine on. We have our step wedge ready to go. We're going to start progression. We're going to grab our remote. And how far away should we be when taking x-rays? 6 feet. At least 6 feet.
Social distance, there you go.
Right? So we're going to hold this button down. Hold it down long enough to hear the beep. It's going to change to that blue. Now I want you all to take turns rotating through and seeing what this image looks like. Because remember, we talked about it having to record the different varying density, good God. Okay. So y'all can kind of rotate through. Can y'all see that? Who can't see it? Can y'all see it? So you see how it goes from very, very light at the top, then darker, right? Now I know my x-ray machine is working and I am ready to start setting up for my first x-ray patient, right? Now I can wash my hands again, start putting up my barriers, wash my hands, put my PPE on, spray, wipe, spray, start setting up my barriers, okay? So take my set wedge off. Now, when you are setting up barriers for x-ray, remember also this is not technically, in most clinics, this is not going to be an laboratory area. You're going to be in a single room with more like a barber chair to take x-rays in. So when you're setting up Dexter, right, bring him up to your height. And make sure he's sitting upright, right? Same thing like infection control, you want to use your blue tape to put barriers on any area that you may touch frequently or touch at all, right? So think about this when you're setting up your barriers, right? I know I have to touch here. To touch here, right? Have to touch here. And touching here. I'll put a little tape here, just for moving around purposes. If we are in our operatory, I'll put some tape here because I'm going to be touching the handle. Right. That rest cover for Dexter. Get in there the best you can. Right. Tape for the mouse. Please use your mouse and not the don't use this little sensor pad on the keyboard. Use your mouse to click around, okay? So I'm gonna put some tape on my remote. Maybe some tape here to move around purposes. Right? The point is, you don't have to bathe this thing in tape, right? Just enough tape to where you can move this around, maybe right here too. Get an idea where you're going to be touching. And then that's the only places you put tape, right? So I can move this, position this, move it back, fold it under, right? Bring it down, all without having to touch everywhere, without having to wrap this entire thing in tape. You just want to put it where you're going to be placing your hands, okay? Not over the entire thing. So now that I have my barriers up, right? My room is ready to go. I need my materials. So I already have my sensor because I needed my sensor to take my step wedge and test my equipment at the beginning of the day. Then I'm gonna need some other items, right? So let me get right here. Right, and we talked about these items for the x-ray portion, right? So we have our XCPs, right? Our positioning devices. We have our ring, we have our arm, we have our tab. What area is this yellow for? Posterior, yes, Shannon, perfect. The yellow is for posterior, right? So we have our tab, we have our ring, we have our arm. This is for anterior. And then we have our red tab. And what is the red tab for? Bite wings. We will not be using a XCP for bite wings. You will freestyle those. When you get to your first command, if they stick you in the x-ray room, you will not have time to be fooling with an XCP, or they won't even have enough XCPs, or even if they do have XCPs for bite wings, you probably won't be using them, right? Bite wings, you have to be able to freestyle them and move quickly with them because you would need to order so many in order to be able to use XCPs for bite wings. On an exam day, each doc may see 20 patients apiece, right? And each patient needs bite wings. So you don't have time to deal with an XCP when dealing with bite wings. So you won't learn XCP with bite wings. Just your PAs, anterior and posterior. Okay, so I have my XCPs. When you get your sensor covers out, this is your sensor cover box. These are your sensor covers. You need to take extra out. You need to get extra tabs, right? Because the stickiness wears off and these sensor covers, they tear, right? Real life, you're only going to use, it's disposable. You use it for one patient, you throw it away. But even sometimes in the middle of taking x-rays on one patient, you need to switch out in order to get a good stick and to get a good seating in the patient's mouth. So always take a couple of extra of these out, just in case you need it. So the first thing I'm going to show you is a placement and x-ray for your posterior molar shot on your maxillary right. When setting up your XCPs, it can become a little confusing because depending on what area you are taking an image of, depends on how your XCP will be set up and placed. So, speaking for your maxillary right molar shot, you want to start with your arm. Your arm should not be going inside of the mouth. Meaning, when you come to Dexter, this arm portion, should be outside of the mouth. You see that? So you start with orienting yourself to the side of the mouth you're trying to place and making sure that the arm is outside of the mouth. Once you do that, you can place your tab onto the arm. The holes line up, you just press it on. All right, so I have my arm outside of the mouth. I have my tab placed up because it is for the maxillary, right? So now I have my tab up because I'm doing a maxillary shot. Now I need to place my ring. When you line your ring up, you must make sure that that tab is showing in the middle of the ring. And if not, you gotta fix it. So this is what it should look like when you look through the middle of the ring. You should see the tab right in the middle. But let's say, oh, I wasn't paying attention, right? I wasn't thinking about it, and I stuck it on, turned it, right? Well, guess what? Is that tab in the middle? No, it's no longer in the middle. So you have a way to check and see if you put the ring on correctly. So let's swipe it back, right? Now my tab is in the middle, and guess what? Now I can place my sensor. My sensor should have a cover on it. Now, when you're placing your sensor, your cord should be going the same way your arm is going. So this cord should not be going inside of the patient's mouth, right? It has to be coming outside of the patient's mouth. So it should be like this. So now that I know how my sensor is going to go, I can peel the sticky off. I can peel the cover off. Be careful with these because some of them are kind of old and they like pull the sticky with it. For PA shots, you want to line the edge to the bottom so you have extra sensor going towards your root. Can you see that? Can y'all see over here? Come out here so you can see what's going on. You need to have the extra sensor going towards the root. Now,
and then as far as like left and right, you just kind of put it center. In the center.
yeah. Depends on the patient's mouth actually. Like if this patient has third molars, right, and I'm having a hard time getting the root of that wisdom tooth, I might push it further that way so that I can get further back, right? I might put it so that the sensor goes back a little bit further, and makes it so. Well, it just depends, but default to centered first, right? But you might have to adjust depending on the patient's mouth.
Good question.
Yeah, that's a good question. Okay, so now I want to place it. You're going to have the patient open. You're going to angle it. And you're going to place that tab for your molar shot on your second molar. For your molar PA shot, the tab needs to be placed directly onto the second molar so that you can get all 3 molars in your molar shot. Now, if the patient has a third molar, sometimes you might have to bring it a little bit back on the second molar, but the tab should still be on top of that second molar. You want the ring close to the patient's face, but not touching, as close as possible without touching, right? Now remember, this is your paralleling device. This is giving you the angle that you need to create that paralleling technique, which means you have to line the tube head up directly to the ring, right? So when you come in with your tube head, don't try to create an angle. Just go in and line it up directly to this ring, and it's going to make the angle. Look at it, make sure you don't see any extra spaces, and it's going to create that angle for you. You don't have to create an angle. Let's say you came in and you said, "Ooh, I want to go up a little bit more." Guess what? You are no longer lined up to this ring. Let's say, I'm going to try to go down a little bit, You're no longer lined up to this ring, right? If you line up to the ring, it will give you the shot that you need, as long as your tab and stuff is in the proper position. Okay, so just line it up to the ring. And then take your shot. So, in order to start your x-rays, you're gonna click on Start Progression. Make sure your yellow box, come here, since you're gonna get us to the root, right? Okay, come here, let me show you something. So, this yellow box, right, tells you where your x-ray shot is going to start, where you're taking an image of. This up here tells you the teeth number that is supposed to be for this shot, right? So you don't have to guess. It tells you where you're taking the shot at. Make sure you double check where your yellow box is located so you don't have to worry about swapping the images around because you took your image in the wrong spot. All right. Okay, bring this out. You start your progression. How far do I want to go, right, again? I want to do 6 feet. All right. All right. Now, in real life, I would just keep going. I would take my image, boom, move it, take my next image, boom, move it, take my next image, right? Okay, so come here. I'm gonna make this bigger. Okay. Let me move this out the way. Do y'all see that? Hold on. If you in this corner and you can't see this computer, come around so you can see it. You can see it through here. Okay, so I have what I need in this shot. I have the crown. I have all 3 molars. I have the root. I have the bone around it, right? Some of you may accidentally cut off a little bit of the crown. That is okay on the PA shots, not the bite wings. On the PA shots, because what I am using for the PA shots is to find any abnormalities in the bone, the roots, and the bone around it, right? So as long as I got the root and some crown, right? I got all of the root, I got the apex, I got the bone around it, and I got some crown, I am okay, right? Y'all got that? So now that is your maxillary right molar shot. So let's take a premolar shot. You want to line your XCP to where the tab sits between the first and second premolar. So that tab should be centered to the interproximal space between the first and second premolar. That is how you're going to line that up. Once you have it seated between the two, you bring your ring in as close as possible without touching the patient. Line it up. Six feet. X-ray.
Think of where you're sensitive. You're trying to get your right back. So, like move around.
Okay. So come look at this. So now I have my premolar shot. It has both my premolars, the crown, the root, the bone around it. It does have a little overlapping on the crown. Again, I'm not going to be too concerned with that unless the overlapping is so severe it starts to go into the root area, right? Has a little overlapping, but I won't penalize y'all for that, right? But I have what I need in that image, right? That's the premolar shot. Now, on this program, you'll notice that the yellow boxes will jump automatically to the next area that you're supposed to take an image of. It'll go 1, then it'll go 2, then it'll go 3, and it'll go 4. So, thinking logically, you will think, oh, okay, my maxillary right molar and premolar premolar shot is 1 and 2, then my maxillary left molar and premolar shot must be 3 and 4. It's not. How you're going to do it is you'll take your maxillary molar premolar shot, you will flip this upside down, and you will take your mandibular, stand up for me, stand up, don't stand up. If you are sleepy or if you are tired, then you need to stand up. You will take your mandibular left shot. Once again, you will ensure that your arm and your cord is outside of the patient's mouth. When doing the mandibular shot, right, your sensor will go straight down. It won't have an angle to it. So some of you might have to move Dexter's tongue out of the way, but you're going to get this as far back as you can, and you're going to close it. Place the ring as close as possible to the patient's face without touching. And then line up your tube head.
Over there?
Yes. Yes, please. Just so I could get it.
So she went from maxillary posterior right. She was like this. Or she was towards the premolars. And then she flipped it over. And then went towards mandibular. Okay.
So you just make sure that your box is in, your yellow box is in box number 3. And same process, you get your pedal, right? You hit this center button that looks like a volume button. Hold it. Wait till your image appears. So this is a good image of when you have an error and you got to know what's going wrong in order for you to fix it. Okay, so take a look at that. As you can see, I'm kind of high up, right? Because I have the the maxillary arch in this mandibular shot, which means I need to move Dexter's tongue out the way because the sensor is not seated all the way down where it should be. So, because I know how to fix it, I can retake this image and correct the issue. Okay, so let's fix it.